Okay, so we have 4 really amazing panelists, and you might have seen their companies on the show floor today. A couple of them are exhibiting, and they have some exciting announcements for CES. So first, we have Vicki Mayo. She's the CEO and co-founder of TouchPoint. Vicki, please join us. Round of applause, please. Thank you. All right, and then next up we have Michael Hurnaus. He's the CEO of Tractive for pets. Michael. Dr. Heidi Forbes Öste is a behavioral scientist and author who studies wearables. Heidi. And then we have Dr. Daniel Chow. He is the CEO and co-founder of Halo Neuroscience. Daniel, thank you. So we have a fun discussion planned for you today. So we're talking about wearables beyond just fitness trackers and smartwatches, because that's what people tend to think about when they think about wearables. So we're going to go a little more out of the box and talk about how wearables can affect our lives in some unusual ways. Some of our panelists have companies that are doing just that. And we'll also discuss some of the challenges that face the industry. So to start, I wanted to start with you, Daniel. Dr. Chow, sorry.
Why, because you think neurostimulation is unusual? No, I'm just kidding.
That's a trick question. Okay, but we're actually gonna have you dive into that first. So what problems were you setting out to solve with Halo? And please do give a background for our audience who might not have heard of Halo Neuroscience.
Yeah, so just briefly, my background, I'm a medical doctor by training, master's in neuroscience as well, and my professional life has really been focused on this idea of using electricity as medicine for the brain. So my last company was a neurostimulation company where we built it's like a pacemaker for your brain to treat epilepsy, and that 10-year endeavor led to an FDA-approved product that is helping people with epilepsy in a way that drugs could never even come close to. So I'd like to point to that as Exhibit A, as like an opportunity to really rethink the way we approach the brain, to use electrical interfaces for the brain rather than chemical interfaces. Okay. So that experience led me to the idea around Halo, because I saw neurostimulation doing amazing things in clinical medicine, but they were all medical implants. And I just thought that there was a lot more we can do with the technology, and there was this growing field called non-invasive brain stimulation, which this headset takes advantage of. So the idea behind Halo is like, can we democratize the technology such that just about anybody could benefit from it? So not just the very ill, but healthy people, people suffering from some sort of neurologic or psychiatric condition, could they benefit from neurostimulation without having to go through a surgical procedure?
Right. So
what were we trying to solve? That was your initial question. So, with neurostimulation, there's a lot of different problems that we set out to solve, but maybe the one that's most salient for CES, with the operative C being consumer, is we were, and I apologize if this is going to sound esoteric, but like we set out to solve the problem of how slow human learning is. So, we started with movement learning, in that, if you take a step back and you realize like how much athletes practice, and one of the reasons they practice so much is because it takes so long for our brain to commit this practice movement to muscle memory. So what if we could use neurostimulation to hasten that process, to accelerate that process? Like, what if we could stimulate the brain so that it's in the state of hyperlearning, and then you practice? So yeah, that's the idea behind Halo Sport. We have other products that we're working on that all kind of get at this one central thesis, like how can we speed up human learning?
Okay. So your product looks, a little more traditional, like a pair of headphones. Vicki Mayo, the CEO of TouchPoint, your product looks a little bit like a smartwatch, but not exactly. So I want to give you the chance to tell people what TouchPoint is and also what problem you set out to solve when you created it.
Yeah, thanks, Caitlin, and thanks for having me on the panel today. So TouchPoints are wearable devices, and they do look similar to a smartwatch, but they do something completely different than what smartwatches do. I think today when we think about wearables, we think about trackers. How many steps did I walk? How much water did I drink? How many calories did I burn? But what we've done with TouchPoint, and I love how Daniel talked about democratizing technology, we set out with a very similar mission. My co-founder, who's a neuropsychologist, spent a decade researching and studying trauma and stress and anxiety. And through consulting on the global Ebola crisis, she came up with a solution to stress. And today, doctors constantly tell us, 80% of disease is caused by chronic and excess stress. So how do we really get to the root of that problem? Well, through neuroscience, we've actually found a way to hack the brain. So using TouchPoint technology, we can alleviate your stress by over 70% in just 30 seconds. And where most technology thinks about it from a top down, I'm gonna meditate, I'm gonna get myself in a mindful situation so that I am no longer stressed out, we're doing it truly from a bottom up. So we're using access to technology, which in our case is the TouchPoint technology, to actually go from bottom up. We're saying we've found a way to deliver haptic micro vibrations to the brain in such a way that we're able to alter the unproductive brainwave activity in seconds. And I really think that that's the way of wearables today. Gone are the days of simply tracking things or giving you information. Today, consumers are saying, I want my wearable to do something for me. I want it to be functional. And that's really where we're taking that TouchPoint technology.
Great. And Michael, you do something for pets, which is a little out of the box, but pets are a huge deal, especially now at CES. I'm sure you guys have seen some of the interesting pet solutions on the show floor. So tell us about Tractive and what you were trying to solve with that product.
Yeah, so our product really started as a GPS tracking device for cats and dogs. And the story is, or how it initially went, we were looking for a friend's dog, and that ran away, and we figured there must be some kind of technology that allows you to see where your dog is at any point in time. And back then, that was 7 years ago, there was nothing in the field. So a bunch of guys, we came together to form Tractive and build a product which you can put on the collar of the dog or cat and then see exactly in real time where your dog or cat is. That's the problem we try to solve. Since then, that has branched out into adding activity monitoring, sleep monitoring, so you can basically detect early on if there's something wrong with your cat or with your dog that you might not otherwise see.
Great. So Heidi, I wanted to get your perspective as someone who works with companies and understands the wearables industry overall. Wearables are super personal. We have to wear them on our bodies, or in the case of our pets, we have to look at them wearing one. So they have to be both functional and stylish. So how can companies make wearables that people actually want to wear all the time?
Well, I think what's important to recognize is that, like I talk about it in all of my work, that the anomaly is the norm. So you're not going to create something that's perfect for everyone. Each individual is going to be really looking for something that's solving a problem that is specific to them. And because of that, you have different types of profiles of certain needs, but you also have different types of profiles of people that have experience with prior sort of experimenting with solutions. And that's going to sort of formulate what is going to work for them. So there's a lot of different things that come into it, but it's also sort of some things will be driven more towards women that have a history with certain things, and whereas there may be other things that are designed that really do not appeal to women or do not appeal to people that have had a particular type of experience. And the other piece that came out of my research was really that a lot of people have traumatic experiences with technology at an early stage that really impact what choices they make in technology going forward, and how much technology they choose to integrate into their lives. So it's not just form factor anymore, it's a lot more about how does it fit seamlessly into their lives in a way that they're going to get the intended outcome of it.
Okay. Daniel, going back to Halo, so there's this idea that a wearable device will give you all of this information about your body or your brain and how it's working, and then that data, just looking at that data, will motivate you. But are there other ways that wearables can be motivational beyond just looking at a set of stats?
Yeah, it's a great question. I've always thought that with stats, it's always about like the end goal is behavior change. So if you can use numbers to provide some unique insight into your life, and that motivates the individual to digest that information and ultimately change behavior, that's amazing. But I think there's another class of wearables that I'm calling active wearables, where instead of passively measuring information from the body, we're actively adding energy or whatever to the body, so go in the reverse direction, write instead of read. Our device is one of these. We're actively neurostimulating the brain. We actually don't collect, we collect hardly any data from the brain. Actually, no data from the brain. We collect data on its usage of the device. But yeah, there's in terms of lifestyle and what people can get out of it, with a device like this that helps people learn movement faster, there's things that my goal altruistically for this company and how this can impact lifestyle is to put people on this virtuous cycle where they put in the effort and they feel the benefit of the effort, right? Myself, if I'm studying a new language, I might study German for 40 hours and I don't really learn that much, and that doesn't inspire me to keep going. I find that very frustrating, and so I quit. So the slowness of human learning, especially when we become adults, is a lifestyle killer in my thinking. And if we could speed up the learning curve so you get set on this virtuous cycle of putting in the effort, feeling the reward, that begets more motivation and more practice. And if you stay on this track, this is almost like with kids, you see this because they put in the effort and they feel the reward of their effort. As adults, we don't see that as much, and I just feel like for a lot of grown adults, we give up on our dreams, right? We don't, maybe some of us want to learn a foreign language, some of us want to learn how to play guitar or violin, or whatever it is. I think the slowness of learning actually keeps us from realizing many of our dreams. And back to your first question, I don't think most people realize that this is potentially a solvable problem, right? I mean, I think maybe we've all given up on ourselves, right? In a way that well, I dreamt this when I was 18, but now I'm 20 or 30 years older and I'm going to give up on that dream. I've forgotten about that dream. But what if we can use neurostimulation or other things to learn faster? Maybe some of those dreams can be realized.
That's really interesting because a lot of people I think a lot of people think wearables are, because of the data they give you, they can cause a lot of anxiety because you see, that you're falling behind or you're not living up to the goals that you set for yourself. And Vicki, you make a wearable that's supposed to, de-stress, cure anxiety, and you also, as far as I know, do not collect data on the brain with your device. So can you talk about how wearables can be used? The data that you get is not used to cause anxiety, but rather bring it down. What's the juxtaposition there?
Yeah, absolutely. I think that's a fantastic question. So when we're thinking about this paradigm of stress, it's true. I didn't walk enough steps today. I ate too much food. It does cause a level of anxiety. So I'm really looking at stress and wearables from the form factor and the functionality perspective that we're going to do something for you. And if we are going to collect data, and we do have versions that do collect data through sensors, it's because we're using it to optimize you. So not to make you feel bad or to basically give you just static information that you then have to digest and do something with. I mean, I'm really on that bandwagon of demand more from your wearable. It should be doing something for you and to you. So any collection of data should be used explicitly for that purpose. So taking in, you know, the fact that maybe you didn't walk enough today, well, maybe that is contributing to your stress level. So let's use that as part of our algorithms that we have embedded in our devices to actually reduce that stress. But really, it comes down to that base principle. Wearables should be functional. They should be doing things for you, and the form factor of that, you know, I love how you put that, Heidi. You know, how do we make them, you know, either fashionable or pretty, be able to use them? And so with our TouchPoints devices, you don't have to put them on your arm. You can put them in pockets or socks or put them in your tank top straps. There's so many different ways to use a product. And I think that's something that the wearable industry needs to be looking at. How can wearables be integrated into our lifestyle instead of being one more thing on that to-do list?
Great. And Michael, you also collect data, but on pets, which might be more anxiety-inducing for a pet owner to see, you know, where is my dog, where's my cat, you know, that these are very anxiety-inducing, you know, stats. So how do you use data, and how do you plan to use data in the future to make the product better, but also decrease anxiety for a pet owner?
Yeah, so for the most part, when we think about data, it's GPS tracking is one thing, and that's obviously location data that we provide to the user when they look for their dog. But the most important thing in our when we think about data is activity monitoring and tracking. So it's kind of like the Fitbit for your cat and dog, where you, as you rightfully said, you have to actually do something and act about it. What we do with the data is inform the user if the dog or cat is unusually active at that point. That typically means it's either an indicator for stress or it's indicator for an unhealthy pet or something like that. And we also take this activity information, and we're now building a model, since we have hundreds of thousands of users that wear the devices, building a model to provide the user with more information about food consumption, how much food should your dog, because we know it's a beagle and the beagle is 18 pounds, and we know the age of the pet. Mm-hmm. And so we're working with pet food manufacturers to provide the exact right pet food at the right time, based on how active your dog is and based on the data that we collect. So there's actually an outcome, not just a visualization of charts and numbers, which is fun, obviously, and interesting, yeah. And if you compare to your neighbor's cat or whatever, but at the end of the day, that's how we leverage the data.
Okay, so those are very specific examples that you guys have given. Heidi, in your overview of the industry, working with many different companies, how are you seeing wearables become more useful and actionable using that data? How are you seeing it become more motivational?
Well, so I think there's two different sides to that. One is, what are they doing with the data? And also, sort of, some of them are learning, the developers are learning the importance of only collecting the data that is critical, and that the rest, it's sort of the philosophy of just because you can doesn't mean you should. Right. And really being clear on what it is that you're providing and whether that adds value, so that you can really enhance the experience rather than create more stress and more indicators and more notifications, so that it becomes something that fits more into the human experience in a positive way. And so I think, you know, for example, one of my clients has a bracelet that's doing more authentication. It's like a virtual key that's based on your motions, okay, because each body has a very unique motion base. But one of the things that we really worked on is sort of paring down just how much data they collected as much as possible, so that they could be compatible with all kinds of other devices. And so I think it's the ability to communicate with other devices and other IT around in the full tech ecosystem, instead of trying to be the one be-all, end-all. And so I think compatibility is something around the data, is sort of what data is essential for your device to function, rather than trying to collect all the data just because you can.
Right, okay. So, you know, when we talked earlier about how people think wearables equals fitness tracker or smartwatch, something that counts your steps. I want to talk to all of you about the biggest challenges that you have faced making wearables that are a little more unconventional, at least from, that standpoint. And so what have you faced specifically, and also what do you see for the industry overall and where it's heading? So Daniel, if you could talk about your challenges.
Oh yeah, boy, where do I start?
Keep it to just a couple.
I hate for this to be a therapy session for me, so I would say the biggest challenge that we have is just merely education.
Right.
Most people's first impression when they hear about electrical brain stimulation is that of fear. So it's like pushing a boulder uphill. There's a lot of heavy lifting that goes around really thoughtful and careful communication around how this works and how it's safe, and that it's not bullshit. It's a noisy market, especially when it comes to the brain, that there's a lot of stuff that's unproven.
Yeah.
And so we have to rise above that noise, and that's the science that we do. We have a team of 5 neuroscientists on our team, and we've run over 3,000 research subjects now. So we probably do more neuroscience research in this field than any single lab on Earth. That's our scientific credibility and just the time and care that we take to educate folks one by one that it's safe and effective, and it could play a great role in your life.
Yeah.
It's just we can go on, but for us it's really just education.
Okay. Are you? You don't have to answer this exactly, but do you envision an FDA-approved version of your product?
Yeah. So there's we have a clinical trial using this device, looking at stroke rehab.
Oh, okay.
Yeah. So half of people who have had a stroke suffers from some sort of motor disability. So either they can't walk or they can't use their hand or their arm. And the medicine for that is physical therapy. So it's just practice. Mm-hmm. So to the same extent that we can help athletes with their practice, what if we can help stroke victims with their movement practice? So there's already some interesting pilot data out there that it's actually more than interesting. It looks really good. We want to add to the data that's out there and advance the frontier and actually have an FDA-approved product for this.
Okay, great. Vicki, I think maybe you might have some experience in this field as well, convincing people that, the science is not bullshit, the product is legit and will actually help you. So can you speak to that challenge as well as, the broader industry?
Yeah, absolutely. Thank you, Daniel, for bringing it up, because that is honestly the hardest part, I think, about what we're doing in a wearable sense, because it is such a paradigm shift. People think about stress and they think it's simply something they have to live with. So we do spend a lot of time and do a lot of heavy lifting around consumer education. Yes, these devices that you put in your pockets or your socks or on your arms can really change the way that your brain works. And so I feel that same sense that Daniel does, about educating consumers that this is how your brain works. This is how your stress response works. Your stress response is like a light switch, and it flips on and off hundreds of times a day, and it's not healthy. It was built millions of years ago to keep you safe from saber-toothed tigers, but today it's hyperactive in today's fairly safe world. So how do we tone that down and allow you to use that executive functioning, that sort of prefrontal cortex in your logical, rational brain? So I agree on that, on the education perspective. And I apologize, you asked me one other question, Caitlin.
Oh, just about the broader challenges of, educating people beyond your product specifically, but about, the potential for wearables, the motivational aspect. How do you tell people, wearables are not just fitness trackers?
Right. Well, it's interesting. Our product is direct to consumer, and so we sell straight off of our website. And the people that use our devices are people that are everyday people. So they might not necessarily be suffering, or they're not professional athletes, they're not suffering from panic attacks or anything very severe, but they're living with everyday stress in their life, and part of that is the stress of life being life. And to be able to explain to them and share with them, you have a solution. there is something else that you can do besides take that hour out of your day to go do yoga or to meditate or to be mindful. You could actually just turn this device on and go about typing, go about having a conversation with your boss. You know, you can put your set on, hand them to your spouse or significant other, and then have those really tough conversations. So to spend time doing that from a consumer's perspective has required us to really put our thinking cap on and say, what are the everyday challenges that people face, and how can we take our technology and integrate it? And so our big solution, our aha moment, was we created an encyclopedia of uses. Just like you think about an encyclopedia on our website. So you can go to A and there's 10, 20 different things listed under A, and another 10 or 20 under B, and how to put your kids to sleep. Are you afraid of the dark? How to talk to a spouse about something difficult. And that was our version of educating the consumer.
Okay. So Michael, you have a totally different experience because your wearable is for pets. So your challenges, I'm not sure, are they similar in terms of education? Are they totally different? Do you have some mixture of both? What are you facing?
I guess they're similar in the sense that the biggest challenge for us, because it's not a standard wearable as like a fitness tracker for humans or some of the ones that you see all over the place, but it's something different and it's a new market. So for us, it's not necessarily educating the user. Your dog could run away or your cat could run away. People already know that. But it's people not being aware that the product like that even exists, right? Once they Google for it, once they try to find it, they'll find us or they find the product and they know about it. But the fact, the biggest challenge is that people don't even know that anything like that exists, which is why we, in our field, appreciate any competition too to help educate the market, because the pet market specifically is huge, of course. Yeah. So there's space for a lot of players, but it's about market education, telling the users that the product like that even exists. I think that's probably similar for you and for you as well. People might not even know or probably don't know that something like that exists. So that's something that starts to slowly get better and better as the pet world gets a little bit more digital and people are a little bit more aware of that. But there are so many, and I think there's so many products, if you look, walk the floor downstairs, that are different now, that are trackers or wearables that you probably were not aware before the show that they even exist or somebody's actually working on something like that. So that is a challenge and will continue to be a challenge for sure.
Yeah, Heidi, so working with companies, you spoke earlier about how wearables have to know their market, they have to be specific, you can't have one size fits all, but then that leads to challenges, letting people know, like, we're making the product that solves your problem, but maybe you're not sure it's a problem and you definitely don't know there's a product for it. So how do companies deal with that challenge, and how do consumers find the thing that they need but don't know about?
I think a lot of that, as all of the other panelists have mentioned, is really about communication. I mean, when I did my dissertation 4 years ago, and it was on wearable technologies and presence of mind, and everyone assumed that the entire range of technologies that I used were fitness trackers. Right. But I mean, the range of devices that we used in that study were from an EEG, the Muse, all the way to, there were some fitness trackers in there, of course, but then we even had a wearable vibrator to stimulate oxytocin. So, I mean, there's such a range, and it is a lot about communicating the different alternatives for solutions and focusing on the solution in your communication rather than this new shiny object, fancy device, I think helps a lot with helping the consumer actually find it, and for the developers to actually find their consumers. Because it's the outcome is what you're trying to deliver. It's not the new fancy object. And like what you're doing with the strokes, I think that is something that they're not looking for something that looks like a headphone, but you can provide, you can deliver that that outcome that they need. And so to be communicating more about the fact that there's a new solution for the physical therapy or alternative to physical therapy, or something that can complement the physical therapy to make it more effective, that solution is where the communication needs to reside.
I think it's interesting that the wearables that our panelists have developed, they do have form factors that people are already comfortable with. So, you have headphones, you have, wrist tracker, you have something, attached to the collar of your pet. How much of that was intentional, thinking, people are gravitating towards the look of this and it needs to be comfortable for them? How much did that influence the form factor you chose for this technology? Daniel, sorry.
It was a lot. It was a big part of the design. One thing that we thought a lot about as we launched is really to be sympathetic of the rest of the world. Like, we're different from the rest of the world because we live and breathe neurostimulation, and we know the rest of the world generally doesn't. So when we decided to, which product are we going to build, so there's different brain targets that we were considering, and there's one thing about the motor cortex. So Halo Sport is just a marketing term for a motor cortex neurostimulator. Happens to sit right above our ears, almost in this horseshoe shape going from ear to ear. And so that led us down the path of wow, not only is the data rock solid, the form factor could be awesome. We can build it into a set of headphones. And for us, the ear cups are really just to grip your damn head. This is the business end for us.
Right.
But the beautiful thing about headphones is that everybody knows how to use it, right? And so the neuroanatomy, you don't even have to think about. You just put this on like a regular set of headphones, and these electrodes land right on the motor cortex.
Okay.
So yeah, it was and I, thank you Beats for making headphones fashionable. So that's also nice.
That helps, yeah.
But for us, it was just a great form factor because we got what we want in terms of the neuroanatomy, and the users got a lot of ease of use for free.
Right.
Yeah.
Okay. Vicki, same. How did you decide on the design? How much of it was the fact that people are comfortable with the way this looks on the wrist?
Right.
How much of that influenced your decision to put it in that form factor?
So it was extremely intentional, actually, Caitlin. We knew that we were changing this paradigm on stress. You can actually push a button and actually stress and de-stress just by pushing a button. And we knew that was such a huge leap in the consumer's mind. So we thought, how can we introduce it into something they're very comfortable with? Well, when we released our product 25 months ago, people knew what wearables were. They were very familiar with Fitbits, very familiar with Apple Watches. And we said, we'll do the same thing. But we also knew as people understood what our product does, they were going to want to wear it in different ways. So we actually made them modular. So you can slide the wristbands off and just use them as independent devices. And that's why you can put them in your tank top straps or pockets or socks. So we knew that our product was going to evolve. And truly, sure enough, it really has. The majority of people, 50% of people today tell us, we don't actually wear them on our wrists. Thanks for the wristbands, but we put them in zippered sweatbands. We put them in our socks. We use them in a variety of other ways. But that initial release, like Daniel, let's piggyback off of something consumers already understand and know, because it makes it that much less difficult for us.
Okay, yeah, same question. How did design go into, how much were you thinking of the customer is familiar with this design, with attaching something to a collar, that would make it easier for them, or was it just really the only place that you could put a product like that?
Well, cats and dogs don't wear too much clothes, or not. Most of them don't.
No
so
pockets.
it's very, very limited space that you have.
Right.
And since we're not in a situation yet where we can implant the technology, I think that's something that's way along the lines. But so we had to do something on the collar that's hopefully not too intrusive, doesn't break off, doesn't hurt the pet, but it's still something that's tightly connected, so we can collect the data and keep the connectivity as well. So I think for us, it was a little bit easier when it comes to that, because there's not too many options that you have.
Right. So the three of you make devices that do very, very different things in different places on the body. So Heidi, you've talked about, very niche products. People have to know their markets. There's not one size fits all. But do you think that one day we will see a super wearable, a device that really can do it all, can be everything to all people? And if so, what form factor would that take? What would it look like?
Well, I think, like I said, the anomaly is the norm, and that To think that one thing is going to work for absolutely everyone, I think that that's probably not the case, but I think and I hope that things will communicate better with each other, so that even from the simple thing of being able to, minimize the amount of charging cables and everything else, but also in how they communicate. And so, for example, to be able to share with HealthKit and with, the Google Health, to be able to communicate with your doctor doesn't matter, so that everything becomes more platform agnostic, so that the individual can actually choose the platform that works best for them. So I don't see any sort of super platform in the future, but I do hope that, and I do think that we're moving towards a place where we're going to need to be more platform agnostic in when we're developing wearables and other technologies that need to potentially share data to be able to get, better healthcare and better communication. So if it's, a wearable that's, sort of an alert device for if you're in trouble, for example, that it doesn't only communicate with certain platforms. It's something that should be able to be platform agnostic.
Okay. So the future of wearables is not one wearable, it's that all wearables share essentially a dashboard where all of your information is fed, and you have an overview and everything, you can see everything at once. Is that?
Yeah, I would think that there would be less friction with trying to create, for example, individual apps and individual, ways of communicating with your devices, but also with the ultimate communication, the ultimate platform that holds all of your data, so that you can get a better holistic understanding of what's going on for you without having to open up 10 different apps. Right. But I think that each individual will choose what platform they're going to use that's going to be perfect for them.
Okay. Daniel, same question for you. Do you think there's one day a super wearable? Will it look like a pair of headphones? What do you think?
Yeah, probably. I mean, actually, as part of this conference series, I spoke at a fashion tech conference where they're thinking about smart textiles and things like that. So, imagine something that could be machine washable, it could be yours, it could be stylized in a way that, fits your, your personality. Like, if that could tell you things about the way you move and your heart beats and the way you sweat, and it can all go to one app, and that would be amazing. I guess for me, just personally, I worry about data and how data breaches seem to happen every week. Yeah. And the more data that's out there, the more data I worry about me personally. Like, maybe I don't want all of this data to be shared with my life insurance company, for example. Like, maybe my premiums go up the next time because they know something about me that maybe I don't even know. Right. So maybe blockchain or something like that, where we can really secure our own data and make sure it's our data, not up in the cloud. I think for me personally, that would make me want to track more about myself if I could feel better about the security of that data.
Right. Okay. Vicki, same question for you. Is there a super wearable down the line, and if so, what does it look like?
So if you think about wearables and why people are using wearables, it's because they're trying to optimize themselves. I want to be healthier. I want to learn better. I want to know where my animals are. It's all about some concept of self. So I like the concept of a super wearable, but I think what will end up morphing and what will end up happening is that there will be a concept of ambient wellness. So all of the things that our wearables are doing for us, like taking away stress or helping us learn or telling us where our pets are, they will all become embedded in our environment. I imagine a world where I'm driving in my car and TouchPoint technology is embedded in there, and I'm automatically de-stressing. And maybe at the same time, I have my own custom set of headphones that I'm listening to a book on tape, which is teaching me a foreign language and using some of Halo's technology. And my dashboard is driving, my Tesla is driving for me, and it's telling me that my animal's okay. So I do believe that where we're going with all this wearable technology is really the concept of ambient wellness. It's going to be built into our entire ethosphere.
Absolutely.
Yeah. Michael, same question for you. What do you think a super wearable would look like, and is that even possible?
Yeah, I think like what the others said, I don't think there will be one specific wearable that will do it all. I think one thing that we are already seeing is on a connectivity level, the devices talk to each other. That becomes easier, simpler, cheaper. When you look at Bluetooth, pretty much any device, pretty much any product, whether it's digital or pretty much non-digital, has a Bluetooth chip in there. Mm-hmm. So at least from a technological perspective, we're getting somewhere where the devices have the chance to talk together, exchange data and exchange information. And I definitely think this is going to bring a lot of good opportunities once we are at least on a technological level very similar, that these devices can talk to each other. We just have to find an ecosystem or interface where they can talk to each other in the right way, and I think this is something that that's going to happen more and more, and we're going to see a lot in the future.
Okay. So for our final question, I just want to ask all of you what you're most excited about for the wearables industry in the near term, in the next year or two. Where do you see things going? You know, there's a lot of emphasis on wearables that are, you know, embracing medical features and actually seeking FDA clearance. That seems to be a huge trend, especially this year. So what gets you excited, and what are you looking forward to, Daniel?
Yeah, so just to tie on to that medical comment, so I'm really excited about the medical applications of neurostimulation. Mm-hmm. I think it could be a drug alternative. You know, I think drugs for the brain, for neuro and psychiatric conditions are used way too much for not that much benefit, mm-hmm. and for a decent amount of side effects. And there's like this very personal side of me that like I feel like I'm on a war on drugs, like legal drugs, prescription drugs. Yeah. That there's maybe very ambitious and humanitarian effort that like I hope myself and Halo can embark on, is just to reduce the pharmacologic load on the brain, and replacing that with neurostimulation, which almost has no side effects.
Right. Okay. Cool. Heidi, what are you looking forward to?
I love your mission, being a chronic pain sufferer myself. So, but I would say absolutely, on the digital health side, that's the place that I'm the most excited. I think I've seen such incredible leaps that have happened in even just the last short period of things that are actually doing more push rather than just pull in terms of benefits, and that we're actually seeing them. It's not just a lot of fluff. There's actually things that are going through clinical trials. There are things that are finally getting to the level where they're getting the FDA approval and having really big impact. So I think that is the place that I'm the most excited to see where wearables are going. Definitely.
Great. Michael, what are you excited about?
Probably mostly from a technological perspective is that communication chips and components need a lot less power, and I think that's will allow us to create a lot smaller wearables for various areas, less space, less weight, combine the functions of multiple wearables, and then you don't have I don't know, a fitness watch and a running watch and an activity tracker and many different things, but they're going to be smaller, consume less power, need to be charged less frequently, which is definitely something I think we have in a lot of wearables, which is a problem. So I think there's going to be a lot of improvements in the next 1 to 2 years. So definitely looking forward to that.
That's a good point. Vicki, what about you?
I'm very excited about all the new technologies that are constantly being discovered and integrated in devices, especially in the area of health and wellness. I think the more we're able to have people operate at optimum and to be more peaceful and more in tune with themselves, I think in general it's going to help all of humanity. And as far as trends, I really do believe that we're going to see a lot of our bigger houses, you know, the Samsungs, the Apples, the Philips, buying up and using their innovation labs to really aggregate and consolidate a lot of the up and coming technologies. And we're going to get to a point in the next 2 years where there's going to just be a few big players in the market, but they're going to each have a subset of technologies that they're really spending time and energy optimizing.
All right, great. That about wraps it up for us. Thank you so much to our panelists, Daniel, Heidi, Michael, Vicki. Thank you so much for joining us. Thank you all for spending your last session of your day with us. We appreciate it.